Good morning, everyone. I'm James Latumbo, and I will be discussing sexually transmitted diseases. But before we start, let's know if there is a difference between STI and STD. Is there really a difference between STI and STD? Yes. So one of the obvious difference between STI and STD is their name. So STI stands for sexually transmitted infection, while STD stands for sexually transmitted diseases. But what is the difference between infection and disease? So, infection implies the presence of the pathogen. Ito po yung moment na may nakapasok na bacteria or virus sa body natin. While disease occurs when the cells in your body are damaged as a result of the infection. Ito naman po yung moment na nakapag-multiply na yung mga virus na nakapasok sa body natin and nagsistart na siyang magdulot ng damage sa body. The second difference is that STI doesn't cause symptoms or asymptomatic, while STD have very clear symptoms or symptomatic. So, STI gives zero symptoms. Possible po siya magka-symptoms, pero very minimal lang, to the point na hindi napapansin nung affected person. Samantalang yung STD is kitang-kita or halatang-halata yung mga symptoms. The third and last difference is that STD always start as an STI. You can assume that this is a by-stage or level disease. STI is the first stage, while STD is the last stage. Meaning po na before a person obtain STD, he or she must have an STI first. Hindi pwede magkaroon ng isang STD ang isang tao kung hindi muna siya magkakaroon ng STI. Pero hindi lahat ng STI ay nagiging STD. Kung nung una pa lamang ay nagapan na ito or na-treatment na agad, ay hindi na siya magiging STD. Now, let's formally discuss what STD is. So, STD or sexually transmitted diseases is a disease brought on by infection with a particular bacteria, viruses, or other microbes that can be spread from one infected person to another. So, as I said earlier, disease is caused by an infection. This infection can be either virus, bacteria, or parasite. So, itong mga infection na to can be passed from one infected person to another through sexual contact and intimate physical contact. So, ano nga ba yung mga pwede natin makonsider as sexual contact and intimate physical contact? So, the things that we can consider as sexual contact are vaginal, oral, or anal sex, while for intimate physical contact are kissing and cuddling. Different types of STD. So, there are 7 different types of sexually transmitted diseases, which are the chlamydia, herpes, gonorrhea, HIV and AIDS, HPV, syphilis, and trichomoniasis. The first one is chlamydia. So, chlamydia is one of the most prevalent sexually transmitted infection and is brought on by a bacterial infection called Chlamydia trachomatis. It is frequently transmitted through sexual intercourse or coming into contact with infected genital fluids like semen or vaginal fluid and can infect both men and women. So, as stated po in the presentation, chlamydia is caused by a bacterial infection called Chlamydia trachomatis. Chlamydia is also referred to as silent infection since most people with chlamydia doesn't have symptoms. Katulad ng ibang types ng STI and STD, it is transmitted through sexual intercourse. However, there are cases na pwede kang magkaroon ng chlamydia without even having sex. Basta magkaroon ka lang ng contact sa genital area or genital fluid ng partner mo, ay pwede ka nang makakuha ng chlamydia. Chlamydia can infect both men and women. However, it is more prevalent in women because if it's left untreated, it can cause serious problems such as pelvic inflammatory disease, ectopic pregnancy, and infertility. Although hindi nagkakos ng symptoms ng chlamydia, still here are some examples. Pain when peeing, unusual discharge from the vagina, penis or bottom, pain in the tummy, bleeding after sex, pain and swelling in the testicles. The second one is herpes. So herpes is a sexually transmitted infection that is caused by the herpes simplex virus or HSV. It results in painful blisters called herpetic sores, which can erupt and ooze fluid on your vaginal or rectal area, buttocks, and tights. So herpes has two types, which are the oral and genital herpes. The picture that you are seeing right now in the presentation is an example of oral herpes. Oral herpes can be found in the lips, mouth, and throat, while genital herpes can be found in the genitals, such as scrotum, cervix, vulva, and butt. Herpes is caused by the herpes simplex virus or HSV. HSV has also two types, which are HSV1 and HSV2. HSV1 are the one who usually causes oral herpes, while HSV2 are the one who usually causes genital herpes. So basically, HSV1 is the oral herpes, while HSV2 is the genital herpes. It causes painful blisters called herpetic sores. The picture is an example of it. So para po siyang butig-butig na may laman tubig, diba? So symptoms are pain while urinating, sores in their genitals, itching or burning, fever, swollen lymph nodes, or muscle aches. The third type is gonorrhea. So gonorrhea is an STI caused by a bacteria called Neisseria gonorrhoeae. It is prevalent, particularly in young people between the ages of 15 and 24, and can result in the infection of the throat, rectum, and genitalia. So gonorrhea is an STI caused by N. gonorrhoeae. Gonorrhea is the second most common STI after chlamydia. So sa bansa po natin, kilala yung gonorrhea as tulo. Samantalang sa ibang bansa naman po ay kilala siya bilang the clap or the drip. Both men and women can get it, though men get it more often than women. Usually, the infection can be found in the genital area, but if the infection is found in the throat, like in the picture, it just means that this is caused by oral sex. Gonorrhea is also commonly called as pink eye because of how it looks. So, signs and symptoms of gonorrhea are abnormal discharge from the vagina, penis, or anus, pain in the lower belly, rectal pain, especially when having a bowel movement, and pain when peeing. So the fourth type is HIV and AIDS. So HIV or human immunodeficiency virus is a virus that attacks the body's immune system by destroying a type of white blood cells that helps the body to fight infection. While AIDS or acquired immunodeficiency syndrome is the end stage of HIV infection. It occurs when the body's immune system suffers significant damage from the virus and has extremely low levels of certain white blood cells. So, HIV and AIDS are different. So, para silang STI and STD. HIV is an STI while AIDS is an STD. HIV is the first stage while AIDS is the last stage. Which means na bago magkaroon ng AIDS ang isang tao, dapat magkakaroon muna siya ng HIV. So, HIV or human immunodeficiency virus is an infection that attacks the body's immune system, specifically the white blood cells called CD4 cells. HIV destroys these CD4 cells, weakening a person's immunity against opportunistic infection such as tuberculosis and fungal infection, severe bacterial infection, and cancers. While AIDS or acquired immunodeficiency syndrome is the disease caused by the damage of HIV. AIDS is the stage where a number of potentially life-threatening infection and illnesses have happened to the immune system because of HIV. So, AIDS yung stage kung saan sobrang vulnerable na ng body sa infection and illnesses dahil napahina ng HIV yung immune system ng body. So, possible signs and symptoms of HIV and AIDS are sore throat and painful mouth sores, swollen lymph glands, mainly on the neck, skin rashes or bumps, and oral yeast infection. So, the fifth type is HPV or human papillomavirus. So, HPV is one of the most prevalent types of sexually transmitted infection and frequently results in growths on the skin or mucous membrane. The majority of HPV strains are benign and go away on their own, but others can cause cancer or genital warts. So, HPV or human papillomavirus is a group of viruses which has more than 200 types. These 200 types fall into two groups, which are the low risk and high risk. Low risk HPVs are the one who causes warts or mucous membrane. An example of this is the picture in the presentation. These warts can be usually found in the mouth, throat, and genitals, while high-risk HPVs are the one who causes several types of cancer, such as cervical cancer and oropharyngeal cancer. Katulad ng ibang types ng STI and STD, you can get HPV by having vaginal, anal, or oral sex. However, it is commonly spread during vaginal and anal sex. HPV does not usually cause symptoms, but sometimes the virus can cause painless growths or lumps around the genital area. The sixth type is syphilis. So, syphilis is a sexually transmitted infection that is caused by the bacteria called Treponema pallidum. Syphilis is curable in its early stage, but if left untreated, it can cause disability, neurological abnormalities, and even death. So, syphilis is an STI that is caused by T. pallidum. The infection in syphilis develops in stages: primary, secondary, latent, and tertiary. Syphilis is most infectious during the first two stages, primary and secondary, and each stage can have different signs and symptoms. Syphilis starts as a painless sore, typically on the genitals, rectum, or mouth, and spreads from one person to another person via skin or mucous membrane contact with the source. The example of this source is the picture in the presentation. Katulad ng chlamydia, you can get syphilis without even having sex. Basta magkaroon ng contact lang sa source na to, ay pwede ka nang magkaroon ng syphilis. Primary and secondary symptoms of syphilis include round syphilitic sores, gray or white lesions, swollen lymph nodes, and patchy hair loss. And the last one is trichomoniasis. So, trichomoniasis is a sexually transmitted infection that is brought on by the parasite protozoan known as Trichomonas vaginalis. Symptoms of the infection are quite infrequent, but if they do, they often start to show up 5 to 28 days after the infection. So, trichomoniasis is caused by Trichomonas vaginalis and is commonly called trich. Trichomoniasis is the most curable type of STI, which can be cured by taking antibiotics. Most people with trichomoniasis have no signs or symptoms. However, symptoms may develop over time. When signs and symptoms develop, they are different for men and women. Symptoms for women include foul-smelling discharge from the vagina, genital redness, burning and itching, and discomfort over the lower area of stomach. While symptoms for men include burning while urination or after ejaculation, discharge from the penis, and itching or irritation inside the penis. Now that we have already tackled what are the different types of STD and STI, let's now proceed to the mode of transmission. So, here are some of the ways STD and STI can be transmitted. The first one is through unprotected sexual intercourse. So, the disease or infection can be sometimes found in the body fluids, such as semen, vaginal discharge, and blood. Which is why if someone had an unprotected sexual intercourse with an infected person, the disease could be also passed on him or her. The second way of transmission is through blood transmission. As I stated, the disease or infection can be sometimes found in the body fluids, such as semen, vaginal discharge, and blood. Which is why if the blood of an infected individual has been transfused to a non-infected individual, he or she may get infected too. The third way of transmission is through needle reuse. So kahit saan naman, even sa mga ospital, ipinagbabawal at delikado ang mag-reuse ng needle since nagamit na nga siya. Kaya kapag nagamit sa'yo yung needle ay hindi lang infection na makukuha mo, kundi iba't ibang uri ng bacteria. And the fourth one is through pregnancy. If the disease that someone acquired can be found in the genital area, the baby can be infected since during the delivery, the baby will pass through the birth canal or vagina where the infection or disease can be found. Meron ding iba pang mode of transmission like kissing and touching of each other genitals or coming into contact with the source. However, hindi siya applicable sa lahat ng types ng STD and STI. Applicable lamang siya sa chlamydia, herpes, syphilis, and HPV. So, ito, dagdag information. So, kanina sinabi ko na infection na nagkukos sa mga disease. Diba? So, itong infection na to could be either bacteria, virus, or protozoa. So, dito tinukoy natin kung anong type ng infection siya. So, sa chlamydia and gonorrhea ay bacterial infection. Sa trichomoniasis ay protozoa. Sa HIV and AIDS, virus. Sa syphilis ay bacterial infection. And sa HPV and herpes ay virus. So, sa transmission naman, ito yung way kung paano siya pwedeng mapasa. So, sa fluids ay chlamydia, gonorrhea, trichomoniasis, and HIV and AIDS. Samantalang sa skin-to-skin naman ay syphilis, HPV, and herpes. Curable and treatable. So, there's a difference between the STI and STD being curable and treatable. Kapag treatable, pasamantala lang natitreat yung symptoms pero hindi na mawawala yung disease. So, kapag treatable po, symptoms na lang yung natitreat niya, hindi na yung pinaka-disease dahil permanent na siya dun sa body ng tao. Samantalang yung curable naman is mawawala entirely yung disease sa pamamagitan ng pagtitake ng antibiotics. So, kapag curable po ay magiging tuluyan ng free yung tao mula dun sa infection na yon. So, ano nga ba ang mga types ng STI and STD na curable and treatable? So, the curable types are chlamydia, gonorrhea, syphilis, and trichomoniasis, while the treatable types are HIV and AIDS, herpes, and HPV. So, chlamydia, gonorrhea, syphilis, and trichomoniasis can be cured with the right medication and antibiotics. However, if they are left untreated, magiging treatable na lang siya. Example of antibiotic given to infected patient or individual are oral azithromycin and benzodiazepine penicillin G. For the treatable, we have HIV and AIDS, herpes, and HPV. The symptoms of infection and disease can be managed with treatment. However, it won't cure it dahil sabi ko nga kanina, hindi na makikure yung disease dahil permanente na siya doon sa individual. Taking treatment will also lessen the risk of spreading the virus to others. Actually, HPV is neither curable or treatable. However, it depends on the type of HPV. If it's low-risk HPV, then it will go away on its own. But if it's high-risk HPV that causes cancer, then it might become uncurable or treatable only. The next is prevention. So, in order to avoid contracting sexually transmitted disease and infection, the Center for Disease Control and Prevention (CDC) have provided action steps. Now that we have finished discussing STI and STD, let's proceed to the common questions and misconception about it. So, the first question is it true that only people with a lot of sexual partners get STI and STD? So, the answer is 50% yes and 50% no. 50% yes because it contributes to the factor, but 50% no. Because there are cases na isa nga lang yung sexual partner niya, pero yung sexual partner naman na yun ay merong STD. So, makakakuha pa rin siya, diba? So, as long as you engage into sexual activity, ay may chance na makakuha ka ng STI and STD. The second question is, do only gay men get STI and STD? No. It doesn't matter what sexual orientation you are. It doesn't matter if you are queer. It doesn't matter if you are lesbian. It doesn't matter if you're gay. So, as long as you are sexually active and engage into sexual activities, you can be at risk of acquiring STD and STI. So, dito naman tayo sa mga misconceptions. So, the first misconception is, I can only have one STI at a time. Unfortunately, it's possible to have 2 or more STI at the same time. Pwede kang magkaroon ng chlamydia habang meron kang gonorrhea. Pwede kang magkaroon ng HPV habang meron kang herpes. This usually happen kapag meron kang multiple sexual partners, lalo na kung pareho yung merong STI or STD. Yung isa merong chlamydia, yung isa merong gonorrhea. So kapag nakipag-sex ka sa kanila, ay pwede mo makuha pareho yon. Pero pwede din naman na isa lang yung sexual partner mo, pero yung sexual partner mo, dalawa na yung STD. So, makakuha mo din pareho yung STD na meron siya. So, the second misconception is a condom protects you from all STIs and STDs. So, sinabi ko na to kanina, pero sasabihin ko ulit. Condoms doesn't give 100% protection since pwedeng mag-malfunction yung condom. And meron ding types ng STI and STD na hindi kayang protectionan ng condom like HPV and herpes since itong infection and disease na to ay matatagpuan outside the genital area. Kaya bang protectionan ng condom yung area outside the genitals? Hindi naman, diba? So, that's all. Thank you for listening. Now, let's proceed to the next reporter, which is Mr. Raymond Soliba.
Good morning, everyone. I am Raymond C. Soliba Jr. and I'm going to present natural and artificial method of contraception. Let's move first to the natural contraception. There are many natural methods of contraception, but I will discuss only 7 of it, such as abstinence, calendar method, basal body temperature, cervical mucus temperature, symptothermal temperature, ovulation detection, and coitus interruptus. First natural method of contraception is abstinence. Ano nga ba yung abstinence? Abstinence, this is natural method, involves refraining from sexual intercourse and is the most effective natural birth control method. With ideally 0% fail rate, it is considered to be the most effective way to avoid sexually transmitted infection. Ang abstinence daw ay may tuturing na the most safest way of natural birth control method. Bakit nga ba? Sa process na ito, individuals think that they are not ready to have sexual intercourse. They kiss, cuddle, and do some things but not doing sex. There are many reasons kung bakit nila ginagawa yung abstinence. Pwede ayaw nila mabuntis or ayaw nila magkaroon ng sexually transmitted disease. The second natural method of contraception is the calendar method. This method, also called as the rhythm method, it entails withholding from coitus during the days that woman is fertile. According to the menstrual cycle, the woman is likely to conceive 3 to 4 days before and 3 to 4 days after ovulation. The woman needs to record her menstrual cycle for 6 months in order to calculate the woman's safe days to prevent contraception. Ano nga ba ang calendar method? Ang calendar method ay kilala rin sa tawag na reading method. Ito ay ang pag-estimate ng fertility ng isang babae base sa menstrual cycle. Ito. Sa pamamaraan nito, mainaalam kung kailan fertile ang babae at kung kailan hindi. At dito pinapayo ang pagtatali. Sa pagbilang kasi ng mga araw ng pagitan ng menstruation, malalaman kung kailan ang ovulation ng babae. Subalit, ang calendar method ay nangangailangan ng maingat at metikulosong pag-unawa sa ovulation cycle. Dito nakasalalay ang pagiging epektibo ng pamamaraang nito. Higit sa lahat, kailangan alamin kung kailan safe o epektibo para sa babae ang calendar method. I will show the picture or illustration on how calendar method works. Day 1 out to day 5, your period starts or dito yung period nagsisimula. Day 6 to day 12, the new egg matured. Lining of uterus begins to thicken. Day 13 or day 12 to 15, the ovulation egg release. And day 16 to day 28, egg travels to uterus. If not fertilized, dissolves. Lining of the uterus continues to thicken. Ibig sabihin, ang ovulation ay nangyayari ng isang beses lamang sa isang buwan. Kadalasan ay 12 hanggang 16 araw matapos ang regla. Kapag ang itlog ay lumabas na ng ovaryo, ang buhay nito ay maaaring 24 hanggang 48 hours lamang. Sa makatuwid, ang babae ay fertile o maaaring mabuntis kapag siya ay nasa ika-5 araw bago ang ovulation, sa mismong araw ng ovulation. At sa ika-12 or ika-12 hanggang ika-24 hours pagkatapos ng ovulation. The next natural method of contraception is basal body temperature. Ano nga ba ang basal body temperature? Basal body temperature or BBT indicates the woman's temperature at rest before the day of ovulation and during ovulation. The woman must record her temperature every morning before any activity. A slight decrease in the BBT followed by a gradual increase in the BBT can be a sign that a woman has ovulated. Sa basal body temperature naman is nire-record yung temperature every morning and sinusulat sa calendar. It takes a few months bago mo malaman kung kailan ang iyong ovulation. If the temperature slightly decrease, it means that this is the day you're about to ovulate. Temperature tend to decrease right after your ovulation and increase after your ovulation. Just like in the picture. The temperature is balanced not until in the day 9 to 30. The temperature decrease, it means that this is the day of high fertility and increase on the day 15 up to 28. The fourth natural method contraception is cervical mucus temperature. Cervical mucus temperature, also called Billings ovulation method. The cervical mucus method is based on careful observation of mucus patterns during your menstrual cycle. Before ovulation, cervical secretions change, creating an environment that helps sperms travel through the cervix, uterus, and fallopian tubes to the egg. Ang cervical mucus temperature, dito naman tinitest yung mucus na nire-release ng isang babae every day. Just like in the picture. If your mucus is dry, it means that you are not fertile. Kadalasan ito makikita kapag day 1 to up to day 3 after the period. Next is if the mucus is sticky paste, ibig sabihin is not fertile pa din. Makikita ito kapag day 4 to day 6. Kapag sticky paste naman, it is a white or cloudy in color, forms small sticky clouds. Next is kapag daw ang mucus ay creamy paste, ito na yung semi-fertile. Kadalasan itong day 7 up to day 9. This is creamy or cloudy in color, abundant and thick. And last is the clear paste. Ito naman yung fertility magic. Dito ka na fertile. Kadalasan siyang nakikita sa day 10 to 14. It is like a raw egg white and stretchy and slippery. The fifth natural method of contraception is symptothermal contraception. Symptothermal contraception is a birth control method in which women collect information to inform themselves of their menstrual cycle. These methods depends on the observation during the menstrual cycle of signs and symptoms that correlate with different hormone levels as indicators for an approximate time frame when ovulation is likely to occur. Due to the data collection that is required by the patient, symptothermal contraception is commonly referred to as fertility awareness contraceptive method. Ibig sabihin daw, sa symptothermal contraception is pwede ka gumamit ng dalawang method or ginagamitan ito ng dalawang method. In the picture, ginamitan niya ng dalawang methods such as basal body temperature and cervical mucus method. The woman measures her basal body temperature with a thermometer every morning upon awakening. Basal body temperature is defined as the lowest natural body temperature recorded after a period. The temperature must be recorded at approximately the same time each day. The woman also evaluates their cervical mucus and its texture, consistency, and color every day. During the fertile period of the menstrual cycle, the cervical mucus is reported to be clear, stringy. It can be stretched between two fingers to a length of at least 6 centimeters long due to an increase in estrogen at the end of the phase before ovulation. Next natural method of contraception is ovulation detection. Ovulation detection uses an over-the-counter kit that requires the urine sample of the woman. The kit can predict ovulation through the surge of luteinizing hormones that happens 12 to 24 hours before ovulation. For example is in the picture. Test strips and digital ovulation test. Kapag isa lang daw yung guwit, ibig sabihin negative yung test. Kapag dalawa yung guwit, ibig sabihin positive yung test. Pag digital naman gamit, pag plain na bilog lang ang lumabas, ibig sabihin negative yung test. Pero kapag nakasmile yung lumabas, ibig sabihin positive yung test. Last, natural method of contraception is coitus interruptus. Coitus interruptus, also known as withdrawal, pulling out, or the pull-out method, is a method of birth control in which a man during sexual intercourse withdraws his penis from a woman's vagina prior to ejaculation and then directs his ejaculate semen away from the vagina in an effort to avoid insemination. In this process naman daw, when the man is about to ejaculate, he immediately takes it away to avoid insemination. Ano nga ba yung insemination? Insemination is to introduce semen into the genital tract of a female. The next method I will present is the artificial method. There are many artificial methods, but I will discuss only 6 of them, such as oral contraceptive, vaginal ring, hormonal injection, chemical barriers, condoms, and surgical methods. First, we go to oral contraceptive. Oral contraceptive, a pill used to prevent pregnancy. It contains hormones that block the release of eggs from the ovaries. Most oral contraceptives include estrogen and progestin, also called birth control pill. Ang oral contraceptive naman, ito yung mga nabibili sa mga drugstore. Ito yung mga pill na makakapag-prevent ng pregnancy, just like in the picture. Next is the second artificial method is vaginal ring. Vaginal rings are polymeric drug delivery devices designated to provide controlled release drugs for intravaginal administration over extended period of time. The ring is inserted into the vagina and provides contraception protection. Just like in the picture, para siyang bilog lang siya. It releases a continuous dose of the hormones, estrogen and progesterone into the bloodstream to prevent pregnancy. Next artificial method is contraceptive injection. Contraceptive injection prevents pregnancy by injecting a synthetic version of the hormone, progesterone, called DPO. Kung sa may oral contraceptive, meron ding injection. Ang example ng mga contraceptive injections are Cyclophem, Feminena, Lunella, Misygena, and Novafem 6. Kadalasan to mga mahal to, mga expensive. Next, artificial method is chemical barriers. Chemical barriers or spermicides are sperm-killing substances available as foams, creams, gels, films, or suppositories which are often used in female contraception in conjunction with mechanical barriers and other devices. There are 6 types of spermicides, such as contraceptive film, spermicidal foam, contraceptive sponge, contraceptive inserts, tablets or suppositories, spermicidal gel, spermicidal cream, and gels. Ang example nito yung mga implants, kung medyo familiar kayo. Spermicides are usually available without a prescription or medical examination. Next artificial method is condoms. Condoms is a sheath-shaped barrier device used during sexual intercourse to reduce the probability of pregnancy or a sexually transmitted infection. There are both male and female condoms, just like in the picture. Medyo familiar na kayo sa mga condoms, lalong-lalo na sa male condom. And ganyan naman itsura pag female condom is mas malaki siya. Last artificial method is surgical method. There are two surgical methods such as vasectomy and tubectomy. Vasectomy is a form of male birth control that cuts the supply of sperm to your semen. Just like in the pictures, kinakat niya yung vas deferens that supply the sperm to your semen. And lastly, the tubectomy, also known as tubal sterilization. It is a permanent method of contraception in women. It is a surgical process that blocks the fallopian tubes, thereby by preventing the egg release by the ovary from reaching the uterus. Meron siyang apat na ginagawa para ma-prevent or para ma-block yung fallopian tubes. Just like in the picture, pwede siyang putulin at tayin, pwede siyang ipitin, pwede siyang i-block gamit yung plastic band, and pwede rin siyang i-block gamit yung clip. And that's all for our topic today. Thank you for listening.